Good morning, ladies. I am Karen Ray, and this is Fave Lifestyles and the Fave Biz Society. And we are going live and asking the experts those tough questions about what they do, how it can help us, and how we can move forward in life and business. So today, I am so thrilled to have Dr. Rachel Jelanovic with us. She is a physical therapist. She is a pelvic floor specialist. And so okay, this is going to be an interesting topic because this is not just your everyday conversation.
It is for me.
You know, when I met you, Rachel, I'm like, okay, tell me about this. So let's first start out though and introduce you. So tell us a little bit about you, and then we'll get into our topic, which is going to be, let me go scroll down here, learning about what's normal and what is pelvic floor, physical therapy, and how can it help us? So, yeah, so tell us a little bit about you and how you kind of got started in all of this.
Oh, wow. How I got started. That's a long story, but I wanted to be a physical therapist since I was 10 years old and kind of took a tumultuous path to get there. Didn't really have money for college. So I joined the military as a search and rescue swimmer. So I did that I was a search and rescue swimmer off of helicopters for 4 years. And then I was able to switch within the military, and I still wanted to be a PT. So I was able to actually transition in the military to be a physical therapy assistant. And then I did that for the next 3.5 years or so. And then I finally got out and finished the bachelor's, finished the doctorate. And I knew the whole time that I was in that doctorate, I wanted to specialize in PT and pelvic floor. Because while I was in the military, I had been in orthopedics and just outpatient, standard, all my back hurts, all my knee, my shoulder. And it kind of got boring to me. So this is just like a much more intricate, much more complex field. And it was super interesting. And I just realized how many people it affected and how many people don't talk about it. And how needed it is in our community, in every community, just because it affects like 70% of women at some point in their life. So, I mean, that's massive. If this was, if this was more talked about, there would be more care.
So yes, and we've had some opportunities to chat, and I think there's some things about this whole pelvic floor. There's things that women think are normal that maybe aren't normal, and what all that encompasses. And we'll talk a little bit about that. So I am so thrilled that you are here, and you have a kind of a new kind of business, a new kind of PT as well, where it is mobile.
So I am a new business and a new Washingtonian. I just got, my boyfriend is active duty, and I just got stationed. Well, he just got stationed here. We moved from San Diego just a couple months ago. So when I got here, I couldn't find my dream job. So I opened my own practice, and I'm both mobile and I offer in-home. On location here in my house, I have a private treatment room. So I can, if someone's too far out of my mobile range, then I can see them here, or I can do telehealth. So I kind of do it all. But I try to stay within 25 minutes of Lake Stevens. Okay. Ideally, right now, being a newer business, I'm not as busy, so I can travel a little bit further, 30, 35 minutes. I can fudge it a little for now, but as business picks up, which from the resounding, oh my gosh, we need this in our community, I expect to be quick.
Yes. So let's get into our topic, because I know there's a lot we can talk about here, where we are limited on our time. But so pelvic floor physical therapy, what is it, and whom can it help? Who are those?
So types of things that people come and see us for. Pain with intercourse. First of all, pain with intercourse is never normal. It's always not good, not okay. It should never be painful. Leaking, so stress incontinence. There's also urge incontinence when you're going to the bathroom and you just can't quite make it and you leak on your way there. Or mixed incontinence, where you have both. There's a couple other kinds of incontinence that is more neurological based, or more physical, like you physical limitations that just you can't physically get to the bathroom in time. That those are other things that we can treat as well. What else? Difficult.
So do you find that a lot of women with some of these things just say, oh, it's my age?
Yeah.
Oh, I had kids.
Yeah.
You know,
Yeah.
this is the way it's supposed to be.
And
So
I'll tell you, this is not a curse of being a mother. This is not solely due to you aging, because there's people who are 80 and have no problems, and there's people who've never had children and have problems. So this is not, normal across the spectrum. So
mhm.
just because it's common doesn't equal normal. So it's really important to talk about it, because when I was told about it by my mother, she said, "Oh, this is my curse for having you. Thanks, daughter." And she believed that for 30 years until I learned better and told her, "Hey, like, this isn't normal. I know you've been dealing with this for 30 years. You need to go to a pelvic floor PT."
Yes, and so I like what you said. It's common, but not normal.
Yes.
And if we would talk about it, we would know that.
I know, and it's embarrassing. Okay, and here, and I'll start this off. I'll talk about the embarrassing stuff, right? So I was 13 and I started having leaking with running, and my mom had always leaked and told me about it all the time. And so I thought it was like, oh, it must just be my genetics. And I was a shy kid and I didn't tell anyone about it, and I didn't talk about it for a decade. And until I realized, like, oh, this isn't normal. Like, not everyone doesn't do this. Like, oh, okay. So then I started to go and get help. But I mean, I was 13, so I wasn't even sexually active. I had no reason to have any issues, and I was having problems. So
Mhm.
this isn't like some sort of curse of postpartum womanhood. Like,
Right, right. So what are some of the other common things that to be looking out for?
common things, feeling like you have to pee all the time, like peeing more than 8 to 10 times in a day is like, it's not normal. Like, you're going to the bathroom a lot. Like, why are you going to the bathroom so much? Are you not fully emptying? Are you drinking stuff in your diet that's irritating your bladder lining? Do you actually have a bladder condition? Like, what, we've got to kind of tease that out. Going to the bathroom more than once in the nighttime. So waking up to pee more than one time is not normal. There's something else going on. What else? Feeling like painful bowel movements, coccyx pain with sitting, tailbone pain with sitting, um, feeling like you have to strain really hard to have a bowel movement, or feeling like you have to push in order to fully void urine, not normal. Yeah.
Okay. Yeah, so this is interesting because who would think to talk to a physical therapist about
Well, okay, your pelvic floor is made of muscles, and the coordination of those sphincters and muscles and connective tissue in that is both, and remember, the spine ends at the coccyx, so your spinal mechanics play a role here. And oh yeah, oh yeah. So I've had scoliosis patients who, when I worked on improving their scoliosis, their pelvic floor symptoms stopped.
Wow. And
So
one of the things in your bio I read that you look at the whole body, and here you are talking about that. And that it to me is key
and
because sometimes, I mean, we've all had experiences where, it hurts here, but you really know it comes from something else.
mhm,
They only treat right
totally.
there. And
Totally.
can
Tunnel
you
vision.
look at the whole thing and let's adjust the whole thing so the whole thing is moving properly?
Yeah. So
Yeah.
I like to say that physical therapists bring balance back to your body, right? So
Mhm.
it's usually a tug of war issue of like a weak muscle group and a strong muscle group, or not even a strong muscle group, but it could just be an overly tight muscle group. And tight doesn't always equal strength either. So just something's not functioning the way it should. And we've got to just find that balance and bring that balance back to your body. And then it can function the way it's supposed to function.
Wow. Wow, I love it. So, ladies out there, if you have something, just think in your head, you don't have to tell us, but if you think it's something that, okay, this has been happening for a long time, I wonder if it could be, if there's maybe a solution, maybe there's something that the PT, the doctor can help you with. So, I just am loving this. So,
I've got
Rachel,
a couple more. Wait, before you ask the question, I've got two more things to say on that topic.
okay, go
Another
ahead.
common, very common, but not normal is prolapse. So just feeling like something is falling out, or even needing to, we call it splinting. So needing to physically put your finger in your vagina in order to have a bowel movement, because you're having your rectum is bulging forward so much that you can't poop fully. So
Oh,
I know it's common, but not normal. And people will never talk about this. They just like instinctively know that they need to splint in order to have a bowel movement. And they just are so embarrassed. And they're just like, you'll never believe what I'm about to tell you. And I'm like, oh yeah, it's called splinting. I know exactly what that is. Like we could talk about it. Yeah, let's go. Like it's fine. Like we'll learn how to work around it. It's okay.
yeah.
And then that prolapse feeling of something falling out or something, that kind of pelvic heaviness at the end of the day. And also diastasis recti, where your ab muscles separate during pregnancy.
Mm-hmm.
They're not going back together. You kind of still look pregnant when you're not, after you've kind of fully think you should have lost that baby weight, and you kind of still have that bulging or that coning and doming in your belly.
Mm-hmm.
Those are also things.
So what about like when your upper abdomen always feels bloated? Is that something too that is
Bloating, I typically want to look at dietary conditions and dietary stuff. We do talk about nutrition as physical therapists. It is in our wheelhouse. So because nutrition plays such a huge role in pelvic floor function and vice versa, right? So if nutrition isn't functioning properly, it's harder for the pelvic floor to work, because remember, the sphincteric functions, the closure functions of the pelvic floor, play such a huge role with your bowel movements and your urinary output, and vice versa. So they're so intricately linked. I always talk about nutrition with patients.
Wow. Oh my gosh, so much to learn.
Then we talked about how the spine comes down and inserts into the pelvic floor, right? Through the coccyx. Think about your foot, right? If you're an overpronator, if you've got those flat feet, you've got that arch collapsing every step. That creates an internal rotation torque on your hip, right? Right?
Yeah.
And then little pelvic floor muscles that attach on your hip try to help out, and they're not strong. They're not meant to do that job. They're not meant to help in that function. So something from your foot and ankle stability can be causing pelvic pain or pelvic dysfunction.
What? Oh my gosh, seriously.
So this is why I have a strong feeling that anyone who says, oh, this one thing, this one fancy electric chair, this one Kegel ball is going to fix your dysfunction, I'm like, okay, probably not. There's so many things that go into this. There's never, I wish there was, I'd be so rich if I could find it, just one thing that will fix you. Like, no.
Everybody's unique.
It's so holistic. It's
Yeah.
so integral and integrated in your entire body function, including how you breathe. Like most of my, we can talk about breathing.
Oh, okay. So let's go on to our second topic here, which is some easy ways to improve pelvic floor function. And so, yeah, okay, we're going to get to that one. But first, let's break the myth, because you mentioned about Kegels. So let's start there.
I could use some expletives to describe Kegels.
And we hear a lot about that. Yeah, just do some
about. And they assume that if they're having a dysfunction, that means they are weak and floppy and they just need some tightening. No. Like 98% of women are so uptight, stressed, and upregulated that their pelvic floors can't function the way they're supposed to function, right? It should be able to be at a normal resting tone, contract and relax, right? Fully, and bulge and bear down when you need to have a bowel movement, baby, right? But most people we end up being chest breathers, which doesn't allow your diaphragm to fully expand down into your pelvic bowl. And when you're not, so when you're breathing properly, 360, letting your rib cage expand down and relax, those deep relaxing breaths that aren't.
Yeah, I breathe here.
Right? If you're doing that, your pelvic floor is not getting the benefit of relaxing with every breath.
Oh.
So the first thing I always look at with people, every patient, is how they're breathing, because that is such an easy way to tap into the pelvic floor. The diaphragm and the pelvic floor, I have to scooch up here because this is so zoomed in. The diaphragm and the pelvic floor should work together. So as the diaphragm inhales or lengthens, drops down, the pelvic floor should also lengthen. So if we're not giving a full diaphragmatic belly breath, that pelvic floor is not dropping as much, and you're not getting the benefit of that relaxation. And that means the pelvic floor is uptight. And when you need it to contract and give you extra support for that laugh, cough, sneeze, run, jump, it doesn't have anywhere to go. It doesn't have any support to give you. So it relaxes for half a second, you leak, and then it comes back. So it's this neuromuscular control issue, not a strength issue. This is not like, yeah. So doing Kegels will exacerbate the symptoms and make you worse and make pelvic pain worse because, well, if you're already uptight and then we keep trying to contract, I don't know. I'm so loose. I just need to contract more. I don't know why I don't feel it working. Like, because you're already up to here, girl. You got to you gotta take some deep breaths, my friend.
Yeah. Okay. So let's start there. Taking a deep breath. So let's say you are used to breathing up in your chest. You know, our shoulders go up and down. So if you're not used to breathing that way, how can you explain how to take that breath through your diaphragm?
Try to get up here. Okay. So I put my hands on my rib cage. Oh, okay. I have to center myself. There we go. I'm backwards, and I want to see a big deep. So I should feel it here, or you can do hand on chest, hand on belly, and take a deep breath.
No.
You should have felt your belly hand move first and more.
This is going to take some practice. I mean, immediately could feel my hand on my chest pop up.
I told you, I finally was a patient at 23 years old. It took me a month to figure out how to breathe correctly. So if you can't even breathe right, you are, again, common, not normal. It's okay. What I tell patients is, hey, just set, if you have an Apple Watch, it'll tell you to breathe every once in a while. Or if you have, you could just set little alarms throughout the day to just check in on my breathing. And just, even if you just do it a couple times throughout the day, you'll get that benefit of it. And then you'll start to train yourself how to breathe a little bit better throughout the day.
That is great. That is really great. So what are there a couple other, just some easy ways to improve your pelvic floor function?
In general, every single patient needs some hip strengthening, right? Because those hip muscles help support the pelvic girdle. And then if we strengthen around the pelvic girdle, we can help relax the little muscles inside. And again, we normally want relaxation, not tightening, ladies. So please, if things tell you that we're going to tighten you up and that's what you need, it's probably not what you need.
Isn't that interesting that we've been hearing this for years and years, and it's the exact opposite of what we actually should be doing.
Yes. I know. It's like my number one, I have to take a deep breath every patient who comes in. So should I do Kegels? Should I have some vaginal weights? And I'm like, no, you shouldn't. Probably. Let me check. Let's see. The only patients who I say you can do this, you can have this, because what muscle in life do we expect to be functionally trained, but we go around just holding it isometrically contracted? No. Why would I want a vaginal weight that just holds my pelvic floor up? For what reason? Why do you need that? That's not functional. No. It's not functional.
Oh my gosh. Oh, wow. I never knew this could be a fun topic to talk about.
Oh, it's super fun.
Yes. So, oh my gosh. So tell me, what do people come in experience? What does a pelvic floor physical therapist do?
When they come in, I'm going to look at, well, first of all, the subjective history. I want to know everything. I want to know about your ankle fusion, right? We talked about how foot and ankle stability play a role. I want to know about spinal issues. I want to know about your headaches. If you have TMJ jaw stuff going on, I automatically know you're probably a chest breather. You don't have a lot of thoracic mobility. All that goes back down. I want to know about medications you're on, because some medications can affect stuff. I want to know everything. I want to know about if you had an episiotomy during your pregnancy, how you gave birth. I want to know your birth story. I want to know everything.
What?
Oh yeah. And then I want to watch you move. I'm going to watch people walk. I'm going to watch how they squat, I'm going to look at their hip mobility. I'm going to look at their spine mobility and see if you're compensating on this side because you're weak on that side, or you have no mobility there. So you have extra mobility here. just to compensate for it. So I'm starting to look at the compensatory patterning. And then it's not mandatory, but I get a ton of information if I do an internal exam, and I can find which specific muscles in the pelvic floor are tender or tight or overactive or not functioning correctly. I can get so much information from that. But again, consent is important and we don't have to, but it's a great tool.
Wow. So there is hope, ladies.
There's hope.
That we didn't even know there was hope for. So
I know.
this is super interesting, just how the whole body works, and that we don't have to have these aches and pains or leakage or whatever it is, that there is people out there that can help us with a great sounds like.
It's so exciting.
So exciting. Thank you for coming today.
You're welcome, Karen.
So tell us how the ladies can connect, chat with you, whatever that next best step is.
We'll make sure to put my links in like the description or something, but my business name is Empowered Physical Therapy. Online, you can find me empowered-physicaltherapy.com. Or you can email me info@empowered-physicaltherapy.com. I'm on Instagram. I think I'm empowered_physical therapy there. I know all the business names, right? Or you can text me or call me. My phone number is 425-954-5154.
Yes. And welcome to Washington. We are so glad you are here. I'm so glad that we can chat about these things that maybe we have not, because you maybe have been talking with your girlfriend about it, but she doesn't know any more than you do.
I know. Or she's also got the same problems. And she's like, yeah, me too. It's normal. No.
Common, but not normal.
Exactly.
And there is hope. So, Rachel, thank you for coming and visiting with us today. How exciting to have some hope. And any last word you want to leave with the ladies?
Well, let me know if you want to talk. I'm here, and I try to make things not awkward. So I do my best to make a taboo and sensitive thing not.
Right. And just
talk about. Yeah.
Yes. And just having you here, and just, we can laugh at life's curiosities and oh gosh. So we'll open up the conversation. So, all right. Well, thank you for joining us on Fave Life today. And ladies, have a great day.
Thank you, Karen. Bye.